Welcome to Section 1 of Cardiac Pharmacology. In this section, we'll be discussing pharmaceutical treatment of hypertension. Let's get started. This chart illustrates which antihypertensive medications can be used for specific types of hypertension. And to help orient you, if you look at the leftmost column, we have the hypertension type. For example, primary hypertension, also called essential hypertension, hypertension with heart failure, hypertension with diabetes, hypertension with asthma, and hypertension during pregnancy. And along the top, we have the different types of medications. For example, thiazide diuretics, loop diuretics, ACE inhibitors, angiotensin receptor blockers, calcium channel blockers, beta blockers, and aldosterone antagonists. And knowing which of these drugs are used with each different subtype can be very hard to remember, which makes an image mnemonic very useful. So let's dive into that story and help you memorize all these facts. And I highly recommend coming back to look at these notes because it helps you understand some of the nuanced things that you need to know about each subtype and the drugs that treat them. So let's dive in. This story takes place at a poker camp located in the hot springs and is going to be compartmentalized into each of the categories that we showed on that table. For example, primary hypertension will be right here, hypertension with asthma will be right here, hypertension with diabetes will be right here, hypertension during pregnancy right here, and then hypertension with heart failure will be right here. So let's start with primary or essential hypertension. We see that there's a camper walking up the pathway proudly holding a pressure cooker with a first place ribbon. Let's zoom up. The camp had a chili cook-off and this guy won first place for the best chili recipe. Recall that a pressure cooker is our recurring symbol for hypertension, and this first place ribbon should make you think of primary hypertension. So this should help you remember that this area is devoted to primary or essential hypertension treatment. Notice that this camper is wearing those super cool tie-dye shorts. Tie-dye shorts are the recurring symbol for thiazides. So these shorts on the chili cook-off winner should help you remember that thiazide diuretics are used during the treatment for primary hypertension. Since this is a poker camp, a lot of the campers and counselors are wearing the camp t-shirt with the camp logo, which is an ACE card. An ACE has been our symbol for ACE inhibitors. So the camp t-shirt on the chili cook-off winner should help you remember that ACE inhibitors are used as treatment in primary hypertension. Now, we can see that there's two camp counselors tautly holding a tense rope to block the entrance into the dipping pool. They're here to make sure that no one brings food and drinks into the dipping pool, including chili. Well, two people holding a tense rope is our recurring symbol for angiotensin II receptor blockers. After all, the rope is red, symbolizing blood vessels, which is where angio comes from, and it's tense because they're holding it so tightly, and there's two people holding it. And of course, they're blocking entry. So angiotensin II receptor blockers, or ARBs. So just remember that ARBs are used in the treatment of primary hypertension. Notice that there's another camp counselor standing in front of the tense rope, checking to make sure that no one brings in food or drinks to the dipping pool. He's blocking a line of campers who are trying to sneak in some milk. Well, this counselor blocking the milk-carrying kids from entering the pool is our recurring symbol for calcium channel blockers, because milk is full of calcium and they're being blocked from coming into the dipping pool, and they're trying to come through this channel. So calcium channel blockers. And the reference to the dipping pool should help you remember that we're discussing the dihydropyridine calcium channel blockers. For example, those that end with the suffix dippine, such as amlodipine. So dihydropyridine calcium channel blockers can be used for primary hypertension. Now that we've discussed the treatments for primary hypertension, let's dive into the treatments for hypertension in patients with asthma, which will take place in this section of the camp. Despite all the security around this dipping pool, there are some campers that are still trying to sneak in through the back and the side. And over here, we see one sneaky camper trying to sneak in through this side. Let's zoom in. Like a good little camper with asthma, he's prepared with his little inhaler that you can see in his left hand. Also, he's got some chili he wants to bring into the pool. So he's sitting and waiting until all the counselors have their backs turned away from him. An inhaler is our recurring symbol for asthma. So this inhaler with the kid with the pressure cooker should help you remember that this area is all about hypertension in patients with asthma. Now notice that there's another camper using an inhaler. I guess all the asthmatic campers like to stick together. There's safety in numbers. And notice that he also has an ACE card shirt. It's a poker camp after all. Unfortunately, his ACE card shirt is all tattered. You see, this poor camper is being tightly hugged by another crazy camper who's completely obsessed with him. She's hugging him so tightly that he's actually coughing and actually using his inhaler to breathe. Well, this crazy obsessed camper likes him better without his shirt, so she's ripped it up. Well, this camper's tattered ACE shirt should make you think of avoiding ACE inhibitors. And this camper being hugged so tightly that he coughs and needs his inhaler represents an asthma-related cough. Lastly, Notice that she's dragging him into an area of the woods that are off limits due to danger. As you can see with that yellow caution sign, this represents contraindications. So tying this all together, this camper with the tattered ACE shirt and inhaler next to the caution tape should help you remember to avoid ACE inhibitors in hypertension with asthma to prevent confusion between drug or asthma-related cough, because ACE inhibitors can cause cough. And if they have asthma, you want to know the cause of the cough. So it's best to avoid ACE inhibitors in these patients. Now let's focus on another very important contraindication by turning our attention to that remarkably aggressive girl who's doing the squeezing. Notice that she's dressed up as a cheerleader and is holding some bronchial tree-like pom-poms while she squeezes the life out of her crush. She's shorter than him, so if you look closely at her feet, you can see that she needed to stand on that bait box. It's a tackle box labeled bait, and she needed that to get her high enough to wrap her arm around his throat. Well, in the process of standing on that, she actually crushed the bait box. So let's break this down. The cheerleader with the bronchial tree-like pom-poms squeezing her love interest represents bronchoconstriction. And tackle boxes with bait written on them and have two handles represents beta 2. And the fact that she crushed it represents beta 2 blocking. So putting beta 2 blockade and bronchoconstriction together should help you remember that you should avoid beta 2 blockade in hypertension with asthma in order to prevent bronchoconstriction. Okay, so we've discussed what you shouldn't use in patients with hypertension and asthma, as represented by this violent debacle, but what drugs should you use? Well, turn your attention back to that sneaky asthmatic with the pressure cooker. He's wearing some super cool tie-dye shorts. As previously mentioned, tie-dye shorts like this are the recurring symbol for thiazides. So just remember that in patients with asthma and hypertension, you can use thiazide diuretics. Now the sneaky kid with the inhaler also brought along his fishing pole in the hopes that he could get some fishing in at this camp. Recall that a fishing pole with bait is our recurring. That this kid dropped his beta 1 fishing pole should help you remember beta 1 blockade. So tying this all together, the sneaky kid with the inhaler and the broken fishing pole should help you remember that beta 1 blockers can be used in patients with hypertension who also have asthma. The camp counselors have caught on to the campers trying to sneak in from the side. So they've ramped up security and added 2 more counselors tautly holding a tense red rope. This symbol again represents angiotensin II receptor blockers, or ARBs. And the fact that it's over here on this side, where we represent hypertension with asthma, should help you remember that ARBs can also be used in the treatment of hypertension with asthma. It's a good thing that these counselors are here. They stopped one sneaky camper from sneaking into the dipping pool with his bottle of milk. Recall that someone with milk being blocked from entering is our recurring symbol for calcium channel blockers. So calcium channel blockers, again, the dihydropyridine type that end in the suffix dippine, can be used for hypertension with asthma. Now let's turn our attention to this camp counselor who's cooking, over here in the center of the scene. This super cool counselor has some awesome dreadlocks and dyed beads in his hair. He's in charge of cooking for the entire camp, so we see that he's making some beans over the fire grate and cooking some chili in the pressure cooker. Recall that dyed beads in someone's hair is our recurring symbol for diabetes. So this cooking counselor with dyed beads in his hair, alongside the pressure cooker, will be our symbol for hypertension with diabetes. Now this counselor with dyed beads in his dreads is also wearing some popular tie-dye shorts. And he's busy cooking up some kidney beans over the fire. And all was going well until the kidney beans caught on fire, so this quick-thinking counselor grabbed an ACE card shirt and threw it on the fire to douse the flames. Well, dyed beads in someone's hair is our recurring symbol for diabetes, and flaming kidney beans is our symbol for nephropathy. And the ACE card camp shirt has represented ACE inhibitors. So putting this all together, the ACE card shirt dousing the flaming kidney beans should help you remember that ACE inhibitors are protective against diabetic nephropathy. So it would make sense that a patient with hypertension and diabetes should be given ACE inhibitors. Notice that there's a tense red rope with hanging camp shirts right behind this cooking counselor. This is where the counselor got that ACE shirt that he needed to use on that fire. Well, apparently, one camper was sneaking behind and was trying to steal a kidney-shaped water bottle in one of the camp shirts. But remember that the counselor had actually snatched this ACE shirt from the line, but he did it in such a hurry that the tense rope actually swung back and hit that camper, preventing him from stealing the kidney bean-shaped water bottle. As mentioned previously, a tense rope like this, suspended on 2 ends, represents angiotensin II receptor blockers, or ARBs. And trying to steal this kidney-shaped water bottle, but having it break, represents diabetic nephropathy. So putting this all together, the tense rope and the camper kid getting prevented from stealing the kidney-shaped water bottle should help you remember that ARBs are also protective against diabetic nephropathy. So it makes sense that patients with hypertension and diabetes should be given ARBs. Are you kidding me? Another camper is trying to sneak into the dipping pool. He was seduced by that wonderful aroma coming from the grill, and you can see the camper inhale that scent of food. Who could resist? Admittedly, he was a little more sneaky than the other campers because he tried to hide his bottle of milk in his shorts. Fortunately, a counselor saw him and is now kicking him out. And also know that this guy has dyed beads in his dreadlocks. Remember that milk-carrying kids being blocked is our recurring symbol for calcium channel blockers. So this dyed bead camper getting kicked out should help you remember that calcium channel blockers are used in the treatment for hypertension with diabetes. In some milk, he was trying to bring his fishing equipment too. And notice that this camper being blocked is holding his Beta 2 tackle box, because it has 2 handles and bait written on it, and his Beta 1 fishing pole. So this should help you remember that beta blockers that block Beta 1 and Beta 2 receptors non-selectively can be used in the treatment of diabetes. Notice that both the cooking counselor and the kicked out camper are both wearing those super cool tie-dye shorts. These tie-dye shorts should help you remember that thiazide diuretics are used in the treatment of hypertension with diabetes. As the cooking counselor was hastily trying to put out that fire, he accidentally knocked over a bag of sugar, causing it to spill on the ground. And there were several bait tackle boxes and fishing poles on top of the sugar bag, so those fell on top of the sugar as well. Spilled sugar is our recurring symbol for hypoglycemia, and the bait tackle boxes and fishing poles falling on top of the sugar, kind of covering it, represents beta blockers masking hypoglycemia. So putting this all together should help you remember that beta blockers can mask hypoglycemia symptoms, so they should be used cautiously in these diabetic patients. And it's worth noting that this concept only applies to non-selective or beta 2 blockers, not to beta 1 blockers. Now let's move on to hypertension during pregnancy, which will be located over here. This is another camp counselor cooking some soup in a pressure cooker. Notice that the counselor is pregnant. So this pregnant counselor cooking with a pressure cooker will be our symbol for hypertension during pregnancy. This pregnant counselor's dog has smelled her delicious cooking, so he's next to her eagerly awaiting for some food. Notice that the dog has been dressed up in a furry-looking 3-headed Hydra monster costume to make it look like he has 3 heads. It's kind of cute. Well, this Hydra costume will be our symbol for hydralazine and should help you remember that hydralazine can be used in the treatment of hypertension during pregnancy. While her pressure cooker heats up, the pregnant camp counselor is actually making some soup in this pot over here, and she uses a ladle to stir it up. Look at that giant handle labeled ladle. It's got to make it harder to hold, but it will definitely help her remember that that's the ladle that she needs. Well, ladle sounds kind of like labetalol, so this should help you remember that labetalol is used in the treatment of hypertension in pregnancy. And that's a beta blocker, but we want you to remember the name of this one specifically. So ladle, labetalol. Uh-oh, looks like the pregnant lady is engaging in some bad habits and smoking some dope with her rolled dope. Notice that the container for this rolled dope is metal. So this metal dope idea will be your symbol for methyl dopa to help you remember that methyl dopa is used in the treatment of hypertension during pregnancy. We see that the pregnant counselor is chopping up some vegetables with her knife and dipping it into the pot for her soup. Knife and dipping together kind of sounds like nifedipine. So this should help you remember that nifedipine, which is a calcium channel blocker, can be used in the treatment of hypertension during pregnancy. Now let's focus on the last category, hypertension with heart failure. This camper in the back is holding his pressure cooker and disappointedly staring at the water slide's broken pump. Let's zoom up. He's quite disappointed that the slide's pump is broken. Camp just isn't the same without a water slide. Well, recall that a broken pump is our recurring symbol for heart failure. So this water slide's broken pump next to the camper holding a pressure cooker will be our symbol for hypertension with heart failure. It's really a shame that the water slide is broken. I mean, look at its super cool tie-dye colors. And look at all those loops. Water slide loops are our recurring symbol for loop diuretics. And combined with that tie-dye color, this super cool water slide should help you remember that thiazide and loop diuretics are used in the treatment of hypertension with heart failure. And we can see that there's 2 camp counselors tautly holding a red tense rope to block the entrance into the water slide. They want to make sure nobody tries to use this broken slide. And once again, a tense and red rope held on 2 ends represents angiotensin II receptor blockers, or ARBs, to help you remember that ARBs can be used in the treatment of hypertension with heart failure. We can see that there's a couple of campers playing tackle football near this tense rope. And if you look closely, you'll see that one of the campers is wearing a Tom Brady jersey, signifying that he's the quarterback. Another player is tackling him, which in football is known as sacking, or sacking the quarterback. Well, this camper sacking the QB is our symbol for sacubitril. And this event happening near the tense rope guarding the broken pump and water slide should help you remember that ARBs can be combined with sacubitril for heart failure. In fact, we have a story just about sacubitril, and in that story, we help you memorize the fact that sacubitril is always used alongside valsartan, which is an ARB. So a sacubitril ARB combo drug is used for hypertension with heart failure. Yikes, it looks like there's a passed out camper at the bottom of the tie-dye loop slide. He doesn't look well, but fortunately, he has his heart-shaped tube around his waist. So he's probably not going to drown. Notice that this camper brought his fishing pole and bait tackle box with him, which the counselor has tossed to the side. This counselor has defibrillator pads on the camper's chest to save him, so he has to toss the fishing equipment aside. And the camp has roped this area off with caution tape and placed "Do Not Enter" on a sign here to make sure people know not to interfere. Well, this unconscious camper with the heart-shaped tube is our symbol for cardiogenic shock. And the counselor tossing aside the beta 1 fishing pole and beta 2 tackle box should help you think of beta 1 and 2 blockade. And recall that the caution tape is our recurring symbol for contraindication. So tying this all together should help you remember that beta blockers are contraindicated in cardiogenic shock. And notice that one of the campers getting out of the pool has some really swollen legs. And he brought his fishing equipment to the pool and placed his fishing pole and tackle box to the side so that he can grab the broken pump to pull himself up. Kind of needs that leverage to get out of that pool, especially when your leg's all swollen. He's been swimming quite a lot, so that's why his legs are swollen and he's out of breath. He's exhausted, so he needs to grab onto the broken pump to get out of the pool. If you look closely, you'll notice that there's a strand of caution tape peeking out of the tackle box. Well, this sneaky camper ripped down the caution tape and hid it in his tackle box so that he could swim in the pool. Well, the camper grabbing onto the broken water pump is exhibiting the signs of decompensated heart failure, such as edema and dyspnea. So you should think of decompensated heart failure. And him hiding the caution tape in this beta fishing equipment box should help you think of cautious use of beta blockers. So tying this all together, this edematous, out-of-breath camper grabbing the broken water pump and hiding the caution tape in his fishing equipment should help you remember to use beta blockers, but cautiously, in decompensated heart failure. Notice that in the pool with the broken pump and water slide is a Spyro Dragon floaty wearing an epitaph necklace. A Spyro Dragon is our recurring symbol for spironolactone, and the epitaph that it's wearing is our recurring symbol for eplerenone, epitaph eplerenone. So this Spyro Dragon floating, wearing an epitaph necklace, should help you remember that spironolactone and eplerenone can be used in the treatment for hypertension with heart failure. And that concludes our hypertension treatment story.